Hey, I'm Dr. Brian Gillis. I'm going to talk about some common items that we use for disinfecting, particularly during this Corona time period. The first thing I'm going to talk about is just regular old Clorox. Clorox is good to disinfect almost any surfaces and is good against a variety of things. However, if you were to aerosolize Clorox, it's like chlorine in a pool. If it's really dense, it's going to irritate your airways and burn your eyes, and so it's not particularly ideal for generating an aerosol type of disinfectant. It is good under a doctor's direction. Sometimes we'll use something called Dankin solution, which is a really watered down Clorox approach for an old method to treat chronic wounds. I wouldn't recommend it unless it was under a doctor's order. But it is good, like a little pinch of it in a hot tub, just like we'd use chlorine. It's good to keep that disinfected. The other thing I talk about, Lysol. It's a little bit different type of disinfectant, and with any disinfectant, contact surface time means less viral replication or less bacterial replication, and it does a better job of being what we call bactericidal. It kills the bacteria. This works good. It's aerosolized Lysol. The problem with this also can really irritate the mucous membranes, and particularly if you used it continually and constantly. So it's not absolutely perfect for a continuous infusion in the air because it can be very irritating, but it's a very effective disinfectant. Most of the contact time for these two items is generally 10 minutes or more, okay? And now I'm gonna bring you to another one. This is a hospital grade disinfectant wipe that is an ammonia base, and it generally contact time means that a wet cloth or the surface has to stay wet for at least 10 minutes before it effectively is going to kill all the bacteria and viruses and germs, etc. Now, what's really the safest and most effective and the cheapest? Good old-fashioned hydrogen peroxide. This is a hydrogen peroxide 1.5% strength. Generally, the contact time can be as short as 2 to 6 minutes, depending on which concentration of the hydrogen peroxide you have. It's non-toxic, very effective, inexpensive, easy to make. You can make it yourself. If you make it yourself, you just go to the drugstore, you buy 3% hydrogen peroxide. You can use it full strength, or you can dilute it to half strength. Another effective ingredient that is common in household products that is a good antibacterial, not as strong as the ones I previously mentioned, just good old-fashioned vinegar. Problem with that is that it can have kind of a bad smell. Now, when it comes to COVID, we know that these respiratory droplets that if we wear masks, that's going to prevent the transmission, and I kind of agree with that. So I think if you're out in public, always wear a mask. A cloth mask not as effective as a well-fitting mask, but any mask prevents the projection of particles that occurs while we speak, and of course ingestion of that, you can get sick. So one of the things that you can do that's really easy is you can pick up one of these air humidifiers, and they make them different sizes. You can see the smoke coming out, and if you take 3% hydrogen peroxide and cut it in half or cut it by 1/10, you can aerosolize the hydrogen peroxide, and the hydrogen peroxide is going to go all through the air in here. And particularly if you have a crowded space, like say for example a doctor's office or a surgical suite, this is relatively non-corrosive to surgical instruments, computer equipment, and it's very effective as a bactericidal. And we have these type devices throughout our office to help purify the air. So the other thing too is, so if you see that, that's a mist, and that's hydrogen peroxide. It's very, obviously if this was 7% in industrial strength, it'd be very corrosive. You couldn't enter the room for several hours. You might have some problems. But the weak strength, you can breathe it, and it won't hurt you, okay? And you can also put it in these things, and these make a pleasant mist, and if there's anybody coughing or hacking even under a mask, it's gonna help. I'm not gonna say it's 100%, I'm not gonna say how much it's been studied, but it makes common sense. Anyway, I'm Dr. Brian Gillis. Hopefully you're staying well. Any questions, let me know. Have a good day.